I'm going to go ahead and go back over to our presentation. All right. Well, thanks for spending that time. It's good to get a good look at our visible us of who's here. I'm going to just kind of set the stage for social connectedness and some concepts in our own learnings. I've been studying this area of work for about 20 years. I started studying this stuff when I was in grad school, really looking at the systems level, at how organizations work together to really build strong social connectedness around solving big complex problems. And I quickly became a network scientist, meaning I use concepts of network science and a methodology in particular called social network analysis to measure these things, and went on to work at the Rand Corporation as a policy scientist for a few years, where we got some funding from the Robert Wood Johnson Foundation to start building a platform. I didn't know then, but I know now. I'm a technologist, and my go-to solution has always been some kind of data technology solution. And so from there, I've built out our partner platform, and now this work that I took through to the University of Colorado, Denver, started this Center of Network Science and then Visible Network Labs. But a common thing that has occurred over the last few years as people, especially have experienced collectively as a planet, the COVID and the pandemic and all of the consequences of that is really how social connectedness has become one of our social determinants of health, but not just health, a social determinant of education and well-being, and all kinds of other outcomes for folks. And that's one reason we're really curious about how to measure social connectedness and talk about it and think about it here at Visible Network Labs. You know, I did some Googling of what is social connectedness and how people describe it. And I'm not going to read these out to you, but, you know, there's a lot of words here that we saw in our word cloud about these concepts of social connectedness and what we believe it to be. For example, the experience of belonging to a social relationship or network, you know, experiencing feelings of close and connected, being close and connected to others. A lot of positive things that we can see there. And the last one I liked because it really talked about social connectedness bringing us comfort, providing love, allowing others to confide in each other, but also it being an important for achieving other goals like getting jobs and learning new skills. I think that's something we want to really explore over the next year, which is how social connectedness not only affects our feelings of belonging and love and concepts like that, but also how social connectedness affects outcomes like related to achieving goals or you know, escaping poverty or getting out of different other kinds of situations. And so this is something that we're pretty focused on in different ways. One thing that we do know, and I'm not even going to go much into this here because I do believe that most people here on this call have this frame of reference already, is that there is ample evidence that social connectedness influence outcomes, whether they be health outcomes or other kinds of relationships. There is just an enormous amount of research on this. It affects our life expectancy, our mental health, our physical health, related to all kinds of different things. And there's been studies that show that it's sometimes one of the most important factors in some of these outcomes. So what I'm hoping we can do is kind of frame this from a starting place of where social connectedness is, where we know it's influencing outcomes, but really start to ask harder questions even, which is like, how do we translate that into action and policy and programs and things like that. So what we're hoping to do over the next year is bring a series of webinars that allow us to really say, okay, now what? You know, what are we going to do? What is the next step? From a lot of different perspectives. And so that's kind of the goal here. Some of you might know Susan Pinkler, who studies social connections. And this quote I liked, she said, the research is clear. I can't, 1 second. There we go. The research is clear. Strong social connections predict the quantity and quality of our days. So in an era marked by loneliness and superficial connection, how can we build the connections we need to thrive? And this was printed in an article by Michael Miller in the 6seconds.org site. And I thought this was a really convincing question in terms of, what I'm hoping we can do here. So if we know that the problem exists, how are we going to move forward on that? The way that we, in terms of thinking about social connectedness, we like to frame it in a couple of ways at VNL that might be a little unique. What we know about people is that they do use a lot of informal and formal supports to feel well and to have access to healthcare and things like that. That's not that surprising, but what we have really learned is that what we know about people is that some people have a lot of connections to others, and those connections are strong and healthy and feel really great to that person. But there's also a lot of people who have no one, or just one person. And that variation in the way that social connectedness appears is often invisible. And while we're all embedded in social connectedness and we all have connections, they're largely invisible, not only to ourselves, but the people who care for us. And so it's a concept that, while we can agree it's probably one of the most influential in terms of outcomes, it's also one of the most invisible and hard to understand factors. And so it makes it really challenging for us to take that next step of solutions, policy, program, individual and systemic solutions. One of my favorite things always, and I encourage everyone to do, is when I'm looking up a topic or starting research, I go to Google Images and I just try to see what pops up, especially as I add different factors in. And something that we have really realized is, social connectedness just looks really different. So for some, it's a strong connection to others. We often think of adverse social connectedness as isolation and loneliness. But what we have also found is that there's also folks that are connected to a lot of others that may be unhealthy for them. So connections that necessarily may be not just, the problem may not be that you don't have connections, but that your connections are unhealthy. You might be connected to abusers or users or things like this that make it difficult. So we're really trying to explore the differences in social connectedness that really are not just based on a count of who is in your life, but also the quality of those connections. I loved this quote as I was prepping for this today from Brené Brown. Why human connection will bring us closer together was just a Forbes interview that I looked at, that I found. And she talks about, she was describing social connections, and she said, it's that connection, the spirit that flows between us and every other human in the world. She says it's not something that can be broken. However, our belief in the connection is constantly tested and repeatedly severed. And I thought this was the right thing to bring forward today, because I think one of the things that we also hope to bring as conversation to the table is the complexity of social connectedness. So where it's not, it's something that we often speak about, social connectedness, in a positive way. It's something that we see growing right now in terms of a chronic increases in isolation and depression and social disconnectedness. And so it's such a complicated topic. It's often really difficult for us to really conceptualize it.